There we go.
All right, here we go, guys. We're doing a testosterone replacement therapy, and this time we're maybe doing it on my right side because last time I did it on my left side. So you can see my butt. Dr. Tammy,
Face
who does my
down.
stims, face down, ass up.
Yeah.
We want me to go this way, right?
Yeah.
Okay.
So we're in the Seattle Stem Cell Clinic to do this because this is a great procedure room. And we're all set to do it. So left side.
Nice butt, huh?
Yeah, for sure. It's the little things.
You call my butt little?
No, the tape things.
Oh.
So if you see what they did here, this
They
is
did it way too high, so we want to go right there.
Exactly.
So I prefer doing this, guys, over doing shots just because testosterone shots are a little big and it's kind of annoying doing shots every single week.
Now with him,
So I do this every 6 months is what I do here.
I don't think it'll be okay here. But
And they're going to cut me open. They're going to put these pellets underneath my skin.
Here's your stool for
Oh,
your
thank you.
hands.
There we go.
Yeah, no worries at all.
I'm going to cry like a little girl.
No, I put lots of love in it.
There you go. No, it's very loving practice right here. Welcome to my medical life here. Oh.
So we're supposed to sing.
happy
Are
birthday.
you gonna sing to me?
What do you want me to sing?
Sing happy birthday.
Your personal Spotify?
Yeah, exactly. Imagine Dragons. That's what I want. Remember I told
Yeah,
you?
yeah.
Dan from Imagine Dragons. If anybody knows Dan
You gotta
from
reach out to
Imagine
them.
Dragons, he has a condition that stem cells can help. I so need to meet that man. I respect him. I think he's amazing.
Which condition? Can you disclose that or no?
Yeah, it's on the internet. That's how I learned.
Uh-huh.
It's ankylosing spondylitis, a terrible, painful autoimmune condition that I would love to help him with.
So in this case, make a bigger wheel because your incision is going to be a little
Poke,
bit bigger.
lots of love.
Lots of love.
Nice.
I know,
No, we're all good. I don't
I'm
feel
so
anything.
sorry.
This doesn't hurt at all, guys.
This is the worst part, actually.
I don't even know how many needles I've had me this year, so it's kind of
So now we go through
like a human pin doll. So you're just up here, Doc, are you Doc too, I guess?
Yeah.
Yes.
She's a naturopath from
Yeah, she's a good-looking
Arizona.
doctor. She's life's rough.
You're surrounded.
So we're going to make a little bit wider field this time.
Figured.
Because we're going to have to make probably
Three
three
tracks.
tracks, yeah.
You doing okay?
Yeah. I don't feel anything. Really.
Awesome sauce. Well, this is just the numbing stuff.
My
so
kids beat me up more than this.
I know, right?
Yeah.
Your beautiful daughters, who I got to meet.
Wonderful. I'm excited about our upcoming brain conference that we're doing, huh?
I know.
Sponsoring the Super Bowl and everything. This is
And
pretty big.
benefiting the Wounded Warriors.
Yeah, small benefiting the Wounded. Yeah, we're raising money for the Wounded Warriors there. We're really going after Paul Allen today. Paul Allen, call me. Call me.
Well, we would love that. You know what I love is the stem cell procedures that we do, and part of the national clinical trials. We know that stem cells help the brain. We have the rat study and the human study, but we actually have your personal
Pictures.
images.
This is really
It's
cool.
just amazing.
Yeah, so needed. So, what's your name again?
Dr. Brianna Kane.
Dr. Brianna?
Yep.
Okay, that's my ex-wife's name, Brianna.
Oh, really?
So anyways, have you had other patients that do stem cells every single month then? Like every single month?
We do ours.
She's not doing the clinical trial. Unfortunately, we can't have her part of it. It's a MD thing, but she
She's
does
pretty enough
her
for
own- She does stem cells for a lot of other
We do
stuff.
stem cells for a lot of anti-aging and rejuvenation therapies. Yeah.
So what do you think about doing it every single month like I do?
I think it's great.
So now we need the pellets.
Yeah. So, if you're okay with doing 6, that's what I like to do.
Yep.
You made me a Superman.
No, you're already Superman. We'll just maintain.
Make me a Thor
These
though.
are
I like
all
Thor.
200s.
Thor whole combo play.
4, 6, 8, 10, 12.
So show them what after you put them in the tray here, what these look like here.
I will.
And it seems like a lot of little
They're tiny.
Tic Tacs.
So we're going to put in.
They have redesigned those vials, by the way. I complained about that.
Lord. Oh dear.
I know.
Man, right?
Seriously?
Yeah, you just have to.
Put
You're
your
gonna
tongue in the
crack
right
the glass open to get them?
No, but I've thrown them all over the place before because they just fly out sometimes. They're, yeah, they redesigned.
Wow.
Luckily, they redesigned the vial.
Well, these are brand new. They didn't redesign these ones.
I know. They just did it.
Oh, okay. Way to go. Be a change.
Yeah, see what
Ever.
pan that is? Like it barely fits. You gotta get it just right.
It's like one of those kid games
Sorry,
where you have
guys.
to put
She's
the balls
trying.
in front of the
Oh yeah, right?
into the holes. Maybe I can tell you to work on them at the same time and we can go faster. Thank you so much.
Which one?
See, this isn't hurt at all.
Oh,
Yeah,
goodness.
we're gonna
It's sterile.
make
It's there. It's in the right
We're
place.
gonna make a drinking game out of this. Whoever gets this done last has to drink.
That's not sterile, so
It's
it's
not.
gone.
I'll get another one here.
So I'm gonna ask them to replace that because that's crazy.
It is crazy.
Yeah, where's that Rebel drink company out, by the way?
California. Yeah, they're amazing.
Got it?
I drink, seriously,
Okay.
I probably spend 20, 25 bucks a day
Now
drinking
that
this.
you're- Oh, did you already make?
Yeah, we're done.
Oh, I missed that part. You're way
We're
ahead of me.
good.
Okay.
Did you cut me open
Okay.
already or no?
I got yeah.
You already cut me open?
Mm-hmm.
I got my incision.
Ow!
Okay.
I forgot to say ow.
We'll see if
Zoom up
you're-
on that.
Yeah.
It was the whole like. Do you see it?
It's covered right now.
Oh, okay.
Okay.
Alrighty. So how long
Is
are
there
you
a right way
time
up?
for it now?
Nope, not right way. It's just however. So you may need a little more. You may need to make it just a little bit bigger there. It's the only problem with this bigger trocar is you do need a little bit larger.
You okay?
Yeah.
We could also use an 11 blade. This is not.
I don't feel anything.
This is not.
Tell me when I'm supposed to say ow,
Mhm,
okay?
Good. And if you get to the point where you're, you just do them
Ow.
all the time.
Ew, I'm not even there.
You just get the trocars that you sterilize,
Mm-hmm.
These guys are such a strong man.
Okay.
Okay.
All right, darling.
Okay, I'm just gonna shut up and chill.
All right. So 1,
Yep.
2.
Exactly.
Ready, sweetie?
Yep.
With love in my heart. Yeah, we're gonna have to make this bigger.
Mm-hmm.
It's like when I used to deliver babies. It's got to be the smallest that works.
Yeah, that looks good. Are you doing okay?
Yeah, yeah.
Okay.
It's hard to believe it's already been 6 months. I haven't, so this just feels like she's just kind of pinching my skin, just kind of shaking me kind of a little bit, like kind of grab my love handles.
There we go.
God, I love this doctor.
We love you too.
Ooh.
You okay?
Yeah, I don't feel anything.
That's good. Great.
So can the Seahawks, if they wanted to have these natural testosterone, can they do this or not?
I don't know. Now, it doesn't want to go any further, so I don't want to push it, but that's not very...
No, you're gonna have to go. Yeah, we'll have to go further. There you go. Perfect. Yeah, really, if you pinch
Yeah.
up that tissue, it helps sometimes.
It's like liposuction.
Yeah.
But I think it's pretty cool that, so the professional athletes are not supposed to shoot testosterone, but they can get away with doing stem cells.
Well, stem cells are not anything other than your own body.
Well, I think this is really important to emphasize, Dr. Tammy, because the regulations that they're trying to do when this is just not any kind of medicine, it's your body's own DNA. Like, it's not a drug at all.
It is not, and you know what the other really cool thing is that there's no chance of rejection.
Okay, this time you don't need to remove this piece all the way. Just, pull it back till there you go. Now, you can leave it in the skin, but you have to change your,
right.
Yeah, but you can go somewhere so I can hold
So
this.
I was going to say, somebody's going to have to hold that because there's a really big chance that's going to go on the floor.
There you go.
All right, darling.
Are we done already?
No.
Not yet.
Second one. You okay?
Yeah. The second of how many?
3.
Okay.
Are you feeling pain at all?
Not at all.
Okay.
Is it just uncomfortable there? It's just
Pressure.
sitting on your...
No, I'm just ready to go make some money today. Ready to make some Bitcoin. It's a good thing my Bitcoin miners are just mining for me while I'm chilling here.
That's so funny. Mining. I remember when you first told me about that. I was like, "You're what? You're mining?" It's like you can't mine
Tammy,
something
how's your experience been working with me?
With you?
Yes.
You're a delight. You actually are also exceedingly committed to your health.
No, just pull your, yeah.
Seriously.
And you do what is, the right thing to do, and you've made huge changes in your life. Sorry, darling.
Keep going. I'm really enjoying this. Just kidding.
I love you. Sorry. Just tell me if you have any discomfort.
Good.
So, what do you think? Men and women, should they be getting this done at what age? Or should all women and men, do you feel? Or is that how you feel that should be taking part in this? Or what's your thoughts
Well,
on
I
it?
think everyone should get their stem cells banked. You never know what is going to be going on in the future.
Mm-hmm.
And it's the ultimate bioinsurance that you can be the CEO of your own health. You don't have to rely on big pharma or your insurance company or anything
I
else.
would like to be a boss.
Yeah, you're the CEO of your own life. Pellets and hormones and optimal health, I think everybody should have somebody who helps you look under the hood and see if this would be a good fit.
How often do you think people should be getting their hormone levels checked? 6 months, you think, or?
Well, start with once, and then if you're, depending on your age, but if you're between the ages of 50 or 45 if you're a woman to about 60, 65, that's going to be a big change. Lots and lots of changes at that time.
Because your levels drop substantially, huh?
So we're done.
There you go.
Yeah, so I'm going to cleanse you, and we're going to go and put some steri strips on, and we're done.
Nice.
Yeah.
All right, guys, so it's that easy. Come see Dr. Tammy at Seattle Stem Cell Clinic.
Yeah,
And
give
get
us a
ready
call.
to launch.
It's
our currency.
1-800-817-YES-STEM.
Yes.
And we have free consultations, but we can also talk about hormones, nutrition, adrenal health.
That's
We just
important.
want you to know that you don't have to wait till you get sick. You can look, feel, and function fabulously. And there's natural ways to do it, and we can help.
Alrighty. We're good. Thank you.
Ciao.
Bye-bye.